So I'm going to do the video palpation assignment right now. I'm going to start with the axial spine bony landmarks. Starting with the C7 spinous process, I will have the patient lean their head forward. From there, the first and most palpable spinous process will be that of C7 compared to the different cervical vertebrae in the cervical region of the spine. That is the most prominent and a palpable one. Next, as the patient is standing, I will place my hands around the iliac crest. So from there, I will place my thumbs towards the center where I could roughly find the L4 spinous process. For soft tissue, we will palpate the nuchal ligament, which runs from the external occipital protuberance down to the C7 spinous process. From there, we could also palpate the upper trapezius going down laterally to the acromion process. From there, we could trace it back to the C7 spinous process and then going back up to the external occipital protuberance. Moving on to the shoulder bony landmarks, I will palpate the clavicle by locating the manubrium of the sternum. I will then feel the sternoclavicular end of the clavicle. By continuing laterally towards the acromion, I will be at the other end of the clavicle. Next, to palpate the scapular spine, I will locate the acromion process. That then becomes the scapular spine as you go medially towards the vertebral column. As for soft tissue, I will start by palpating the deltoid muscle by having the patient abduct their arm. I will be able to palpate the muscle which attaches to the lateral 1/3 of the clavicle and also attaches to the acromion and the lateral end of the scapular spine. These three then attach down to the deltoid tuberosity, and that makes up that deltoid muscle. Next, I will palpate the infraspinatus muscle. That muscle could be found by, again, using the acromion to find the spine of the scapula, and right below that, you will be at the infraspinatus muscle. Moving on to the elbow, forearm bony landmarks, I will have the patient extend their arm so that I could palpate the medial epicondyle on the medial side of their elbow, and it's a pretty prominent bone that you could feel there. From there, I will have the patient flex their arm to be able to present the olecranon, and that olecranon has an olecranon bursa over, but you can't palpate that unless it's become inflamed or swollen, so we could really palpate the olecranon on its own right now. Then, having our patient extend back their arm, I will palpate the soft tissue of the ulnar nerve. So pretty below the medial epicondyle, there will be a dip. From there, I could palpate that ulnar nerve. That patient, if I were to put pressure, kind of like press against that ulnar nerve, they will be able to feel a tingling sensation going down. Next, I will palpate the brachioradialis muscle, so that patient will have their arm at a 90-degree angle. From there, I'll put some pressure against their forearm so that brachioradialis muscle could really pop out. It can be felt from the end of the humerus down to the end of the radial bone. Lastly, for the wrist and hand bony landmarks, I will start by finding the scaphoid bone, which if the patient extends their wrist downwards, you could really see a bony projection and feel it on the medial but radial side of the wrist. From there, I will find the radiostyloid process. It is pretty close to that scaphoid bone from earlier. So if the patient is facing down, you will see a projection. To palpate the distal tendon of the palmaris longus, I will have the patient do thumb opposition towards the pinky and slightly flex their wrist towards them. That projected tendon originates from the forearm, but it is more prominent on the wrist and can be really seen there. The next tendon that will be seen is the extensor pollicis. By having the patient abduct their thumb outwards, we'll be able to see a projected tendon also originating from the forearm, but more palpable on that area. And thank you very much. That is all.